Some major COVID-related milestones in Chicago. Today, the city reported its lowest number of new cases and lowest positivity rate since the start of the pandemic. Chicago now sees an average of 157 new COVID cases per day. That's a 38% drop from just 1 week ago. But as public life gets more and more back to normal, businesses reopen and crowds gather in the summer weather, questions remain about what COVID precautions to keep and which to relax. Joining us to answer some of those questions is Dr. Susan Bleasdale, Medical Director of Infection Prevention and Control at UI Health. Welcome back, Dr. Bleasdale. Thanks, as always, for joining us. So, two major COVID-19 milestones today: low test positivity and the fewest cases since the start of the pandemic. Things seem to be getting back to normal. Do you feel like we're opening or reopening at a safe rate?
I think so. We have this recent holiday weekend and we have seen surges before in the last year, but we didn't have vaccine out there. And we have really good vaccine numbers. We have at least over 50% of Chicagoans have gotten at least one dose, and countrywide, at least 62% of adults have gotten at least one dose. So we're really made some significant progress in getting the vaccine out there to help us to safely open up. And we have great data that show how safe and how effective the vaccine is at protecting people. That's why those numbers have come down so dramatically.
Are there still those situations or settings where you would ask people to exercise caution, or certain people who should take extra caution?
Right. I think the big thing to highlight right now is the vaccine is very effective, and it's going to protect you from getting severely ill from COVID, from hospitalization and death. Unfortunately, there are still significant areas of the population that have not been vaccinated yet. People that are not vaccinated should continue to use what is really effective, is wearing a mask and keeping your distance. And that the people that are vaccinated around you will help protect you if you're unvaccinated. But if you're around others who are not vaccinated, we're seeing much of the ongoing transmission is that group that is still not vaccinated. We saw this early in the year when we started with those over 65 to target the vaccine first. And that's the numbers that dropped very quickly related to hospitalization and death. And then we saw, unfortunately, until we had more vaccine out there, this shifting to younger groups. So it's really important for those that are not vaccinated, make sure that you're still being careful, you're still using your mask, and you're keeping your distance. And for those that might be at risk for not getting full protection from the vaccine, maybe you have a condition like having had a transplant of some sort that might mean that your vaccine protection might not be as strong, you still want to make smart choices about when to use your mask, when to keep your distance, and who you're going to gather around to know for sure their vaccine status before you take off your mask.
Now, of course, people are out and about this holiday weekend on the lakefront, dining at restaurants. There will surely be more of that. Besides helping the economy, how does this sort of return to normalcy also have its own health and wellness benefits?
Well, I think it's really important. Obviously, yes, it's important for our economy, but over the last almost year and a half now, we have been isolated. That social isolation has been very difficult. And from the standpoint of just overall wellness and being able to be more active, I think we've seen a lot of health conditions because people have been less active as they've been isolated. And then also mental health, it's really important. It's important, though, for us not to forget, though, if you have signs of illness, like you're having the sniffles, you think you might have a cough, you want to make sure that you are not going out, you're not being around others. You're going to get yourself tested for COVID to make sure so that we can really keep things open and prevent ongoing transmission.
Now, as the vaccine uptake, sort of begins to slow, are you concerned at all that there could be a resurgence?
Well, I think we just need to continue to address the hesitancy that people have. We saw a pretty significant decline when we had some concerns about the Johnson & Johnson vaccine. And then as long as we made that information very available and transparent and shared with everyone that it's very rare and that the risk of any clotting disorders from getting COVID is actually much, much higher than any vaccine that's currently available, I think that's helped people to see the number of people that have been vaccinated and that are safe. and we're getting more and more people that have been waiting carefully to see what happens as the vaccine has rolled out. And so we're getting more people that are interested in getting vaccinated. Again, there's been millions of vaccine doses delivered safely, and you can see how it is preventing these hospitalizations, preventing deaths, and people are safe when they're getting it. So I think this is reassuring. We have to continue to try to get to those that have questions to make sure they can make an educated decision about getting vaccinated. And hopefully they choose to, because it's going to protect them and it's going to allow for increased activities and to protect those close to them that may be vulnerable from severe complications from the infection.
Is herd immunity, is that still a goal? And might it just take us a little bit longer to reach that as you work to convince some people who are hesitant because they've got questions?
Well, I think the trajectory looks good. We had a little bit of that decline, but then as the vaccine became available for that age group of 12 to 15 for Pfizer first and now shortly with Moderna, I think that's helped us to kind of have another surge of vaccine availability. I think as people are seeing that data, I think we'll, again, continue to see more vaccinated, with 62% of the United States having had at least one dose. Most people will get 2 doses, complete the series, if not for any reason that they can't. And so I think we're still on a trajectory to get to at least over 70%, which is somewhat of our goals of community immunity or herd, protection. And so I'm hopeful we'll still continue to get in that direction as we have. We are fortunate in the United States. We have enough vaccine supply so that we can really make sure that the majority of our population is protected with vaccination.
Okay, Dr. Susan Bleasdale, thanks for joining us again.
Thank you.